Okay, we're going to pick up where we left off on the other podcast with neuro. So this is going to finish out your neuro podcast. Okay, we were talking about the little boy in the pronator drift. Just to reiterate that, you're going to have them like his picture. We're going to have him place his hands, or the patient's hands, palm up. And they're going to stand like this for about 20-30 seconds, and they're going to close their eyes, and then we're going to instruct them to keep their arms still, and then we're going to tap them briskly downward. We're going to kind of push on them a little bit, and the patient's not going to be able to maintain extension and supination, and if they drift in pronation, they might have an upper motor neuron disease with this. So that's what it is. Can they kind of recover from you pushing on them fast like that? Can they recover, or are they going to actually do the drift? Okay. And now we have our reflexes. Okay, we've got our bicep reflex, brachioradialis, tricep, patellar, Achilles, ankylosing, plantar reflex. The way we're going to do these, the reflexes, I really like when we actually assess the reflexes. And on the next slide, it'll tell us a little bit more exactly how to hold the hammer and all of that, all of those parts of assessing the reflexes. But when we're assessing the reflexes, it's important that we do it correctly. If it's not performed correctly, then you're really not going to elicit a response. With the bicep reflex, you are going to hold the patient's arm, and they're going to kind of put it at a 45-degree angle on a table or something. It needs to be relaxed. They don't need to have any weight on that arm. And you're going to place their thumb or your index finger over the bicep tendon. So you got to feel for that tendon. Just don't go beating around with the reflex hammer thinking you're going to hit it. Feel for that tendon, and then strike your finger with the pointed end of the reflex hammer, and watch and feel for the contraction. Okay. Then with the brachioradialis, that's going to be, you're going to have the patient lay their arm on the ulnar surface, the hand, and on their abdomen or their lap, so we don't want any weight on it. We want it partially flexed, but we don't want them holding it up. We want it relaxed, and we're going to strike the radius and watch for supination of the hand and flexion of the forearm. With the tricep, you need them to adduct their arm, okay, across their chest and strike the tricep tendon. Or my favorite way to elicit this is you actually put your hand underneath their, kind of on their bicep, and you hold their arm out, and it's bent, and you take all the weight. You are the one holding the weight of that arm, and then you strike the tricep tendon, and you'll elicit a response that way. Patellar, you're gonna have them sit. We've all seen this one. You're gonna have them sit with their legs dangling freely. If they can't sit up, or they need to flex their knee at an angle, and then you're gonna place your non-dominant hand behind it for support, just below the patella. Achilles reflex. This is going to be, you're going to ask the patient to flex their foot, and then you're going to strike the Achilles tendon. Okay. When you're doing the plantar reflex, so with this one, we're going to use the end, like a tongue blade, or the opposite end of your reflex hammer, and we're going to stroke the lateral side of the sole of the foot. And the normal response in an adult is plantar flexion of the toes. So they're going to kind of curl those toes. But dorsiflexion, or the toes fanning, is going to be called a Babinski reflex, which is normal in babies, but it's abnormal in adults. It could be a problem with an upper motor neuron lesion or something of that sort. Abdominal reflex. This is, you're checking that abdominal reflex. That's where you're going to have them laying on their back, and you're going to be coming from the umbilicus kind of out, to see if you can watch that reflex of the abdomen. Now, if somebody's overweight, you won't get this response. It's harder to get with people who are overweight. The best I've seen it on is my children who are pretty skinny. Other reflexes that you should know about, there's different reflexes in that we'll see in infants, and they're called the primitive reflexes. Like you've got the grasp reflex and the sucking reflex. Those are some different ones that you'll see in babies or children, but they're abnormal in adults. Okay, this is the reflex hammer. Okay, make sure you're aware of the different grades of rating the reflex. That's important. You need to tell me in your focus assessment what the grades the reflexes are when you're assessing them. Okay. Grade 2 is usually the normal response. Okay, and through this it tells us exactly how we can assess that and use the reflex hammer appropriately. On down to the reflexes, we can do we talked about the Babinski clonus. With that, we're going to have them support their knee, and it's going to be partially flexed. We're going to quickly dorsiflex the foot, and we're going to look for rhythmic oscillations there. Motor abnormalities, things that we might see in somebody. We might see some spasticity, so that's going to be like marked stiff or rigid muscles, kind of exaggerated deep tendon reflexes. That's spasticity. If somebody's flaccid, it's just there's not going to be any response really at all. It's just going to be there. Tremor, we've all kind of seen a tremor. It's kind of a twitch like. Coordination and gait, point to point. With the point to point, we're going to ask the patient to touch your index finger to the and their nose, alternating several times. You're going to move your finger, so they have to coordinate to go to that point. You're going to hold your finger still so the patient can touch it with one arm and finger outstretched. Ask them to move their arm and return to your finger with their eyes closed. And then ask them to place one heel on the opposite side of the knee and run it down the shin to the big toe. And then repeat that with the eyes closed as well. Romberg. With the Romberg, we need to be prepared to catch them in case they're unstable. We're going to have them stand with their feet together and the eyes closed for about 5 to 10 seconds. And they're going to have their arms out in front of them, and you're going to watch for them to kind of drift to the side. Okay? If this is positive, if they become unstable, it's going to indicate like a vestibular problem or something of that sort. And then gait we talked about already. Sensory. When we do sensory, we're going to explain the test to the patient beforehand, but unless otherwise specified, the patient's going to have their eyes closed during the test. We're going to compare symmetrical areas on two sides of the body with the sharp, soft, sharp touch. So you're going to go from one upper extremity, say you're going to do the upper arm, and you're going to do the other upper arm at the same right after, so you can compare those. And then we're going to compare distal and proximal areas of the end of the extremities, upper and lower extremities. Okay, we're going to use your fingers to touch the skin lightly on both sides simultaneously. We're going to test several areas on both the upper and lower extremities. Ask the patient to tell you if there's a difference from side to side or another strange sensation. Graphesthesia, this is with the blunt end of a pen or a pencil. You're going to draw a large number in the patient's palm. Ask them to identify that number. Okay, so make it an easy number. Don't make it something that you could confuse with another number, but you're going to draw that in their hand. Okay, that's graphesthesia. And stereognosis is you're going to place a familiar object in their hand, a coin, a paperclip, a pencil, something that they can easily differentiate, and we're going to ask the patient to tell us what it is. Okay? Alright, now on to the cranial nerves. Okay. Anatomy and physiology here. We've got the CNS, central nervous system. So that's got the brain, spinal cord, motor, and sensory pathways. Then the peripheral nervous system. So that's your spinal nerves, cranial nerves, autonomic nervous system. Okay, with this health assessment, we have to have a really good present health status. What we need to know what's going on with them. Do they have any numbness? Any difficulty with speech? Vision, hearing, medications they're on, if there's been any recent changes in behavior or their lifestyle. We need this good history. We need to know what baseline we're going at. You need to document this and document it well. Just because everything's perfect doesn't mean that it's going to be like that maybe when they come out of OR and you're not there for the next 4 days and nobody knew this person they all expected this slurred speech because they thought this person had slurred speech to begin with. And so then they don't really go and look for a stroke that could be there, that could be easily treated. Something like that. You really need to document your findings, even if everything is completely normal. Make sure you document it. A thorough baseline assessment. Family history. We need to know if there's any history of headaches, mental illness, any depression, any history of seizures or headaches, head injuries, car accidents, any surgeries, history of strokes. These are all past things in their we need to know if it in their personal past health history, and then in their family history, strokes, things of that sort. Okay, when we're assessing the cranial nerves, we need some certain equipment, and you have to have this. We need a cotton ball, a safety pin, a Snellen chart, tongue blade, tuning fork, reflex hammer, pen light, pencil and paper, sweet and sour substances like sugar, and sometimes we'll do salt instead of sour. You could do sugar and then lemon juice or something. They feel familiar aromatic substances like coffee and vanilla, but be careful with the vanilla. Make sure it's like actual vanilla, because otherwise it's not going to smell like it. Okay, this is a mnemonic that you can use on old Olympus tiny tops, a Finn and a German Butzen hops. Okay, and then they have this other part that goes beside of it, and when you write it all down like this, you can remember what goes with what. So like the olfactory, okay, it has an S right here, so that means it only has a sensory component. So you only need to test that sensory component. So some only have a motor, but like the trigeminal, it has both sensory and motor. So does glossopharyngeal, and so does the vagus. Okay, so we need to test both of those when we're testing our cranial nerves. There might be a bunch of tests listed to assess that cranial nerve, and that's great. You only have to really do one of those. But if it's something that assesses the motor and the sensory part of the nerve, then you need to assess both the sensory side of that and the motor side. Okay? Alrighty. This is a video. I really like it for cranial nerves and going over it just the way he talks about it's a little bit different. There's all kinds of YouTube videos you can look at to kind of help you remember them, because it's a lot of memorization for these, and I really don't say to memorize things a lot, but cranial nerves are just kind of hard to remember. You really do need to try to just get them down. Okay, I'm going to go through them and talk about them, and then I'll post a link to the video. Okay, so we've got one is olfactory. So this is going to carry the smell impulses from the nasal mucosa to the brain. Alright, so to test this, we're just going to apply simple odors to one nostril at a time. So like you're going to use maybe vanilla or something that's easy to differentiate. Don't use Please don't use like Red Door perfume because then I might throw up. Um, just use something that is that you can smell. Vanilla, coffee. You can always give me coffee to assess those. Okay. You want them to identify at least 2 different ones. So coffee, you could do cinnamon, or you could do vanilla. Something easy to identify, but be careful for allergies and make sure somebody's not allergic to what you're going to assess them with. Okay, optic nerve. This is going to be, the optic nerve carries the visual impulses from the eyes to your brain. So to test this, we're going to have them do the Snellen chart, okay, or the Rosenbaum near vision card. We could do that. You can do confrontation to assess the visual fields, and then you can perform an examination of the optic fundi. But really, for your focus assessment, just one of these is fine. Okay. 3 is oculomotor, and actually when you test the oculomotor, you're going to test the oculomotor, trochlear, and abducens all at the same time. Okay, these nerves together, using the corneal light reflex or 6 cardinal positions of gaze, cover or an uncover test. Also, we can inspect the size, shape, and symmetry of the pupils, and then the pupillary reaction to light. Okay, and I just talked about that. Okay, trigeminal. So trigeminal is has a sensory and a motor component to it. So when we're assessing the sensory component to the trigeminal nerve, we can ask them to close their eyes and then touch them with like a cotton ball on their forehead or their cheek. Next, test their pain perception by touching the tip of a safety pin or a paper clip to the same 3 areas, and ask the patient to describe and compare both sensations. Then the motor component of this, we're going to ask the patient to clench their teeth while you palpate the temporal and masseter muscles, and note the strength of the muscle contraction. It should be equal bilaterally. Okay. Abducens, and we talked about this one as well with cranial nerve number 3. Facial. When we're assessing the facial nerve, okay, this is taste for the anterior 2/3 of the tongue and smile. So taste is going to be your sensory. So we can place items with various tastes on the anterior portion of the patient's tongue, like sugar, salt, lemon juice, something bitter. And then the motor, we can do have them frown, smile, show their teeth, puff out their cheeks, whistle, or close their eyes. Okay. Acoustic is hearing. Okay. And to assess this, we'll do the Weber and the Rhine test that we learned about with HENT. Okay. Glossopharyngeal and vagus, you can test those together as well. Glossopharyngeal and vagus, we can test those because the nerves actually kind of overlaps in the pharynx. So we can listen to their voice, check their gag reflex, okay? By touching the tongue blade against the posterior pharynx, ask them to open wide and say ah. Watch for symmetrical upper movement of the soft palate and uvula for midline position of the uvula. And then I talked about the vagus. We can assess those at the same time. Okay, spinal accessory. To do this, we're going to basically have them shrug against with resistance, because this is, you're testing the strength of the sternocleidomastoid muscle and the upper portion of the trapezius muscle is all that this one is. Okay. hypoglossal. So to do this, you'll push the tongue out, move it from side to side with resistance. So it'd be really simple when you're checking the glossopharyngeal and vagus nerve, and you already have your tongue depressor out, to go ahead and assess this one. If you're really systematic and you have to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, that's fine. But it would just be simpler if you just assess this one at the same time. Okay, and that's a sing-along song that I can post a link to on Blackboard. When we're talking about the focused assessment on this, we need to make sure that we're doing the assessment, that we know what we're talking about for all of these. We are assessing their ability, their musculoskeletal and neurologic abilities here. Actually know and do the names of the tests, know the names of them, and perform it in that manner. Use your terminology correctly. Practice this. It really can happen in 15 minutes, but if you don't know what you're doing or you're pretty unsure yourself, it will take much longer, and your time limit is 15 minutes. So that concludes the end of this, the rest of this podcast.